Welcome to the series Employee Health Services, Mind, Body, and Spirit. Employee Health is a section in the City of Albuquerque's Risk Management Division. Its mission is to promote a sense of community and increase wellness among city employees and their families by providing education and counseling about physical and mental health. And now, Mind, Body, and Spirit with Dr. Julia Bain. Hi, my name is Dr. Julia Bain, and welcome to Mind, Body, and Spirit. And today, we have the privilege and the honor to have a couple of incredibly important guests for the state of New Mexico and people in long-term care facilities. We have our state ombudsman, Sandra Everhart. Welcome to the program.
Thank you.
And clinical coordinator, is that correct?
Education and outreach coordinator.
Close enough. Shannon Kupka.
Hi.
Hi, also with the state of New Mexico. Thank you both for being here. We are going to talk about what you do, how you protect our citizens in the state of New Mexico who are in long-term care facilities. There are so many programs and we don't have a lot of time, so let's just jump right in. Maybe you could tell us who, I know there are 53 ombudsmen in the United States and our 3 territories.
Correct.
So there is one for every state, and you are the one for New Mexico. So who are you and what do you do?
Oh, that's an interesting question. I have the honor of being New Mexico's state long-term care ombudsman. My primary responsibility is to protect the rights, both civil rights and resident rights, of New Mexicans living in long-term care facilities. I am privileged to have a staff of 12 who are outstanding. We are all supported by a core of about 130 certified volunteers who go into facilities, meet with people, talk to families, hear what their issues and concerns are.
Thank you for your service.
Thank you. We enjoy it.
So you're the sheriff of long-term care, and you are a state of New Mexico employee, is that correct?
That is correct. I'm a classified employee. In other states, some are gubernatorial appointees, others are work outside government. I think our system in New Mexico is excellent. We are both members of the Aging and Long-Term Services Department. That is New Mexico's designated state unit on aging. So we have a lot of programs that we interact with. We have colleagues who understand the aging concern. Our primary focus is that we are a resident-centered advocacy program. Ombudsman is a hard-to-pronounce word. Difficult to pronounce and difficult to spell, but it really means advocate. We advocate for residents to be heard. As I'm sure you're aware, many times just because somebody has wrinkles and is old, we treat them as though they no longer have the capacity to think. Or if they have a hearing problem, people assume they can no longer think. They think just fine.
Actually, they're a lot wiser than a lot of us. Keep that in mind. Shannon, could you tell us really quickly what your role is with the state?
Sure. I do the education and outreach for the program. So I will go to facilities, do in-service trainings on resident rights, among other things. I'll speak with anybody from the community who's interested in learning more about our program. Our running joke is that if somebody's sitting still for 5 minutes, we will come and talk to you about who we are and what we do, because we're very passionate about what we do. We're very passionate about protecting elders and people living in facilities, and we just do a lot of outreach to communities to try to help them be aware about how to access our services, where to go, what their rights are, and basically, how to self-advocate for themselves.
Okay, excellent. Yeah, be strong. And when you are not able to be strong yourself, we have these people plus all of your volunteers and all of your staff, and you also do recruiting. What if somebody watching the program says, you know what, I'd like to be able to go into a long-term facility and look at someone and say, are you okay? Is there anything you need? Is that basically what they do? They go around and they get to know the residents?
They get to know the residents, they get to know the families, the volunteers provide the eyes and ears in facilities.
Nice.
Volunteers are all certified. We have a 20-hour certification or training, but their primary purpose is to be there. If somebody has an issue, the ombudsman do not work for the facility. We do not work for your children. We work for you, the resident. So
nice.
Our job is to make sure, for example, nursing homes will have a care plan meeting. And everybody's in the room, but guess whom? The resident. They'll have the administrator, director of nursing, maybe the family. They'll have service coordinators. They'll have everybody.
Recreation, social work.
But they forget it's the resident's care plan meeting. Or they'll have a discharge meeting, and everybody's in the meeting but the resident. We insist that residents be present if they want.
Right.
If they'd like to be there, it's their care plan. And families sometimes do the wrong thing for the right reason. Well, Dad gets tired, so we'll just go to the meeting for him. Well, maybe Dad would like to be at the meeting. Maybe Dad would like to know where he's going to live and what's going to happen.
It's his life.
It is his life.
And it is, I think, fearful for a lot of people to think about aging, and that sometimes means losing your power. You know, you lose your home, you lose your car, you lose everything, and do you have to lose your power too? Right. And that's what you are here for, is to make sure that people still have a sense of power and self-direction, right?
You bet. And you know, a lot of people don't realize that when you go into a nursing home or an assisted living, you don't lose the constitutional rights that you've always enjoyed. You still have the right to vote, you still have the right to marry.
You also still have the right to have sex.
You do. And you have rights that are granted to you beyond what the average citizen has.
And not be called a dirty old man or a dirty old woman.
Right.
Which is very disrespectful.
Right.
Well, why would you, I mean, if you think about why people hug, why they touch, they hug and they touch because it's nice. There are few things on earth more comforting than a safe hug. Why would you want to give that up just because you now have a few wrinkles?
Yeah.
And people forget a nursing home is not a prison. It is your home. You ought to be able to sit on the couch and hold hands. You ought to be able to have a glass of sherry or a glass of wine. Why can't you do that? My mother sometimes will have a nightcap. She's in her 90s. Why can't she have a nightcap in a nursing home? Why not? It's a home. And our job is to help the facilities make the home home-like. Pictures on the wall. I mean, we were just in your office. You have pictures of your loved ones around you. Have you ever spent the night in the hospital? The walls are sterile. There are no pictures.
Thank heavens, no.
Well, when you go into a nursing home, it should be your things. It's your home.
Nice, nice. Tell me a couple of those expressions that you said before about, an independent presence. I like that.
The volunteers provide an independent presence. One of the major concerns of people living in nursing homes is retaliation.
Yes.
If I'm relying on you to get me dressed, to get me to the bathroom, to help me take a shower, and to feed me, I really don't want to make you angry. Because
so vulnerable.
If I make you angry, I don't get dressed, I don't get to the bathroom when I need, I don't get a shower when I want.
Not to mention possibly being abused or roughed up or even worse. I had a client whose father was very, very ill with cancer. And he walked into his room and there was he had gone to the bathroom and no one had removed that bedpan. And my client was enraged. You know, how dare you leave this filth 3 feet away from my father's face? So he picked it up and he carried it to the nurse's station, and it was shift change. And he said, "Would you want to lie in a room with this?" You know, and just made a scene, okay? Went back into his father's room, and his father was practically in tears and said, "You know what? When you leave, I'm still here with these people. Don't get these people mad at me. Just really
You know, that vulnerability is just very real.
It is, but it also can be handled calmly. And one of the expressions I'd said to you earlier is, we give our volunteers the authority to kick down the door, but we really would like them to try the knob first. In the scenario
Yes.
you just gave, I would have advised a volunteer to go up to the nurse's station and say, "Excuse me, could you come down to my dad's room and help me out? I have a situation that I believe is unacceptable to me, and I think will be unacceptable to you."
Yeah, that's diplomatic.
Well, but the other expression I told you is the program motto is friendly but firm.
And sometimes people in the family, though, don't have that emotional detachment that an ombudsman would. That's another advantage.
Right. And saying to a staff person, "Excuse me, when you get a minute, could you help me?" And I think that families need to remember long-term care staff members do not get out of bed in the morning deciding to hurt somebody.
Most of them.
How many people do you know get out of bed in the morning wanting to hurt somebody?
1 out of 25
They're
people is a
st-
psychopath. I rest my case.
I remember that.
Yeah.
We only hire 19. We never hire that 20th person. But I think the point is that most nursing homes are safe. Most nursing home staff members are trying to do the right thing. They're underpaid, they're overworked. Look how many years it took society to pay its school teachers a livable wage because the school teachers were raising our children. At some point, society has to realize that $8 an hour isn't good enough to take care of my mother
No kidding.
or your father.
Right, right.
And these people need a career. They need a career in healthcare.
And if I can jump in on this, one
Sure.
of the things that we try to do when we go out and do our trainings is to really let the staff, who are often, again, a lot of CNAs, dietary folks, housekeeping, in addition to some of the professional staff on board, let them know what we're here to do. We're not necessarily there in a facility to find fault or to go around with a white glove and say, you haven't dusted here or there. What we're here to do is point out problems to them in a preventative capacity. So often, if we're seeing something, we can help them resolve the problem when it's still at a very small level and can be resolved locally before it blows up into something that becomes a reportable complaint or becomes an issue where somebody gets hurt. So a lot of facilities are really glad to have an ombudsman there because we're an extra pair of eyes and ears on the care situation.
Right.
And we tell them that when we go in and do training. We are able to have, we have 24-hour a day, 7-day a week access, 365 days a year to any licensed or unlicensed long-term care facility.
Wow.
And we're not necessarily there because there's
By
a
law.
problem. By law.
By
Yes.
New Mexico statute.
Exactly. So when we show up, sometimes we show up in a state car and folks might get a little nervous thinking that a survey team is there or that we're there to investigate something that's a problem. It's not necessarily our purpose. A lot of times we're there to visit because it's, Wednesday or Thursday morning and we happen to have an extra bit of time and we're there to get to know new residents. And what we'll really try to do is go in, find out who hasn't been visited in a while, who doesn't have family or friends. These folks are the most vulnerable. And we'll go and check with those folks first and talk with them and introduce ourselves and let them know what our purpose is and what we're there to do. So
There is a term that's a fairly new term. It's called orphan elder or unbefriended elder. So many families nowadays move away from home. And we get calls quite frequently. The child is in California or New York. The parent is here in New Mexico all alone. That individual can be termed an orphan elder. Nobody comes in and visits. When my dad was in a nursing home, 3 of us visited different days, different hours, different times a day. The facility never knew when somebody would be there. And we tell a lot of people like to volunteer with the ombudsman because you pick the hours. If you want to go in, we had a gentleman down south who stocked shelves at Walmart, and he got off work at midnight and he'd go visit the facility at 1 in the morning.
Wow.
Or we have people that go Sunday night or Saturday morning or Friday night at 8. What a wonderful time to visit a nursing home. So a lot of people like the flexibility in the schedule and actually being able to positively impact the quality of somebody's life. We have the authority to do that.
It's so important. It's so important what you do. It's so important.
And our volunteers are wonderful. They come from all different backgrounds. There's no particular requirement or background that makes for a better ombudsman. It's just people who care and want to make a difference. So,
What number should they call to volunteer?
in Albuquerque, they can call 866-842-9230 to reach us toll free.
Okay. And you, of course, you can always call 311. They know everything. But say that number again.
Okay, 866-842-9230.
And what's your philosophy in terms of, or you were saying a couple of expressions earlier about, what did you say, Sheriff?
I told you our program model is to the world, you may be one person. To one person, you may be the world.
That's it.
And we believe that firmly. When you walk into a room and visit a resident that doesn't have family nearby and say, hi, how you doing? How was lunch? Was it hot? When you got your coffee this morning, was it hot coffee? One of the biggest complaints in nursing homes is, oh, I would love a cup of hot coffee.
Wow, that's when my grandfather, we would go on vacation. When he would order his coffee, he would say, "I want it black and I want it hot."
Yeah.
And why shouldn't he have exactly the cup of coffee that he wants? You know,
Even
just
if
because
he was in a nursing home.
Exactly. Even though he might be with 100 other people, why can't people have the preferences that they like? Why can't people keep the schedule that they always kept? If I like to take a hot shower in the morning and you like to take a warm bath in the evening, why can't you have that? And the answer is you can. So a lot of people don't know that. And
Basic human civil rights.
Absolutely. We really try to help people be able to go in and just exercise those rights, understand what they are. We also realize, though, that we aren't there. We get to leave at the end of our visits. So we try to proceed in a manner and at a pace that the resident is comfortable with. We are not necessarily going to do something if they don't want us to move forward on it. You know, we always
I'm scared, I'm scared, I'm scared, I'm scared.
Absolutely.
What if they say that?
Well, one of the first things we teach the volunteers is to use phrases like some, a few, many. You know, when you go to facility staff, I talk to some of your residents. A few of your residents have this concern. We work very hard to protect the anonymity of any complaints.
We'll never go visit one resident and then go share with a person on the in the administration or on the staff
It's
what
confidential.
the complaint was.
You
Yes,
keep it
absolutely.
confidential. Unless
Confidential.
you have, by law, you have to report to Adult Protective Services.
If
Like if
we
you go and
see
visit
it.
somebody and the bruises on the throat, something like that.
No, no.
No?
Ombudsmen are the only non-mandatory reporters unless we see it. If I walk in the room and I see somebody abusing you, I am a mandatory reporter as an ombudsman.
I see.
But if I walk in and you're bruised, and I say to you, Dr. Bain, could we go talk to somebody? You say, no, I don't want to. I have to honor your wish.
Okay.
The Ombudsman program is based on respect for elders
And for their rights.
and their right to make their own decision. Now, do we just ignore it? No. We would continue to talk to you. We would find out who just visited you. If it was a family member, next time we would ask the staff to have you in the activities room out in public, not leave the door closed. So we don't just drop it.
Prevention.
Right, but we are motivated and driven by the resident's wish, respect for the resident. If I reported against your wishes, I've just disrespected you.
Wow. Excellent. I feel safer already.
Good.
Yeah, good for you. Good for you. So what else? I haven't exactly. Oh, are you involved with the guardianship process, or do you refer people to that?
We refer people for guardianship.
Okay.
And we make sure that their rights are honored through the guardianship process, but also the other end of the process. We have helped individuals who have had a guardian that, say, had a problem with alcohol and were given a guardian and put in a nursing home, and 3 years later they're dry, they're competent, and the guardian doesn't want to release control because the person might drink again.
Oh, wow.
Well, guess what? The decision to drink again rests with the competent person. So we have worked with guardians to release, and the court, to release guardianship when it's appropriate.
Yes.
So we recommend for a guardian if it's appropriate on the front end, but we also make sure that the guardian is appropriate down the road.
I'm very happy to hear that.
And we still try to help people maximize whatever level of autonomy may still exist, even if capacity is a little bit in question. If somebody, can make a decision such as whether they like French fries versus mashed potatoes, to the extent that they can exercise a decision, that's still important.
Decisional capacity.
Right.
I
mean,
love
there might be some decisions, again, as somebody's cognition may change, there might be some decisions that become harder, but the ones that people can make, that shouldn't necessarily be taken from them.
How many people are we talking about?
Decisional capacity?
No, in terms of how in nursing homes in this state.
There are about 12,000 citizens living in long-term care facilities.
Does that include assisted living?
Yes.
Nursing homes and assisted living.
So you go into assisted livings as well?
Any long-term care facility, licensed or not. I can give you an example of what Shannon was talking about. We had a call one day from a daughter who wanted to visit her father. Her father had beginning to middle dementia. The second wife would not allow the children from the first marriage to see their father.
Wow.
So, and now she was the power of attorney, but she does not have that right. And using Shannon's example, this gentleman knew what he wanted and didn't want. And unless his children provided a safety risk, he has the right to see them.
Nice.
Yes.
And there are those people, unfortunately, around and among us that would be happy to take somebody else's rights away because they're into power, control, whatever their problem is.
Or they may just misunderstand, right. There are some people that really just don't necessarily understand the scope of authority of a power of attorney versus a guardian.
Okay.
There are some people that use those terms interchangeably. So there is a lot of confusion around that issue for relatives who might find themselves in a surrogate decision maker role, or also staff who are trying to take care of somebody and may not understand, are they the power of attorney? What does that mean? Is somebody a guardian? What does that mean? Et cetera. So it can be a confusing issue. So a lot of times, again, we try to go out and educate people about what do those roles mean, and again, just allowing somebody to maximize their ability to exert some decision making over their own lives, wherever that is for them.
Exactly.
So.
And for those of you watching, there are angels among us that will protect you and your loved ones in long-term care. And we were talking earlier about what would be a good song to sing. And when we were trying to think about elderly and everything, Sandra came up with I'm singing in the rain, just singing in the rain. I'm not exactly sure why that. Maybe because it's nostalgic and, Gene Kelly, and I don't know. What would he be, 92 by now?
Or over 100, I'm not sure. It was an era. Yeah, he would be dancing.
He would be dancing.
Yeah.
He's still dancing in my mind. I want to make sure we get to a couple of these other questions. Like, for example, I was shocked to learn about the use of antipsychotic medications as chemical restraints. Are you kidding me? Sometimes our elderly are fed pills, so they just kind of, I don't know, don't make a fuss, don't complain. How often does that happen?
A lot, nationwide. Antipsychotic medication is designed to be used for physician-diagnosed psychosis. Why would you use an antipsychotic for a non-psychotic condition?
Keep them quiet?
Keep them quiet. And our volunteers are trained, if you go into a long-term care facility at 7 o'clock and everybody's asleep. Now, you can't convince me that 87 people all had an anxiety attack at exactly 7 o'clock every night of the week. Residents are given medication, you're right, so they'll be quiet and the staff can get some things done.
And on a federal level, there's a new initiative in place to try to prevent that rise of antipsychotic use, because, you know, again, unless you have a clinical condition that warrants it,
Right.
you know, it shouldn't
It's
necessarily
wrong.
be prescribed.
It's wrong.
It's wrong to use any restraint. One restraint that most people don't think about is a recliner. I went shopping with a friend of mine. Her mom is 95. She wanted a recliner. We said, well, get the automatic kind. She said, no, I don't want to spend the money. We said, okay, hop in this recliner. We put the chair back and we said goodbye and walked away. She couldn't get out of the chair. A recliner is a restraint to many senior citizens.
Wow.
They can't work the lever. Needless to say, her mother bought the automatic recliner. You push a button and the
And
chair
it also
goes back.
helps you actually stand up. I've
Yes.
seen those.
Right, but a recliner, if you walk into a long-term care facility and your loved one's in a recliner, see if they can get out of it. If they can't get out of it, it's a restraint.
And how long have they been in it? All day?
That's also a question. Any apparatus that restrains the body that the resident can't get out of. I mean, if I'm falling out of my wheelchair and I want what they call a gait belt hooked around me to help me sit up, but I can undo it, it's not a restraint.
Right.
As soon as you put it on backwards,
It's a restraint.
it's a restraint.
You've lost
a reclining
control.
Right. And go back to medication for a minute. Families can ask to see what's called an MDS. The list of medications.
Okay.
And underneath each medication is the reason the resident's taking it.
Okay.
Okay, they can ask to see that. It's not MD, it's a MAR, a medication record administration, an MAR. It's called just MAR. Ask to look at your loved one's MAR, and it'll list all the medication and why they're taking it. What is the diagnosis leading to that medication?
Yeah, stay on top of it. Free will, free will. I just got the 3-minute sign.
Okay.
Okay.
So we have 3 minutes to say something extremely important, not that the last 27 minutes haven't, but this has been fascinating. And I knew we were going to run out of time. There's so much to talk about. Please tell me you'll come back again.
We'd love to.
I'd
Okay,
love to,
good,
thank
good.
you.
So what closing words do you want to leave the audience with?
Well, I'd like to
Go
just
ahead.
chime in quickly on the medication issue. And New Mexico is actually really progressive in terms of protecting vulnerable adults. And we are working toward becoming, I think, the first restraint-free state in the nation, which is very
Wow.
exciting. We're also working on projects with one of our sister programs, who is the Aging and Disability Resource Center, part of the Aging and Long-Term Services Department, to help raise awareness of Medicare fraud, because that's really becoming a growing issue, not only in New Mexico, but nationwide. People having their Medicare numbers compromised and having prescription medication or equipment ordered erroneously or fraudulently on their behalf.
Thieves.
Well, again,
Millions of dollars.
Wow.
So we're really trying to do some education in the facilities, because that's not only happening out in the community to Medicare beneficiaries, but also starting to creep into the world of our facilities too.
Okay.
So.
Thanks, Sheriff. Thanks for coming on my show, Shannon.
Thank you for having us.
Final words of wisdom. Sandra, Ombudsman, State of New Mexico. Yes, you are cool.
Well, thank you. Words of wisdom is, if you would like to volunteer, we would like to talk to you. We have a core of volunteers. They're fabulous. They really do help people.
They're brave, too.
They're
and
brave.
They're assertive.
Yes, and we will train you. All you have to do is care. We will teach you the rest of it. So if you'd like to volunteer, please call the toll-free 1-866-842-9230. We will send you a packet of information, talk to you individually, and you can make a decision. But we do need volunteers to have a presence in all 350 plus facilities in New Mexico.
And we certainly need you as a community and a state. It has been an honor to have you on my program.
Thank you for inviting us. Very nice.
Thank you so much. And thank you for watching. Volunteer to become an ombudsman. Make a difference in the life of someone in a long-term care facility. You can do it. You can help. It's part of making your place on the planet, important. So give. This is Dr. Julia Bain. Until next time, be happy, and be well.
This has been Employee Health Services Mind, Body, and Spirit. For more information, call the City of Albuquerque's Employee Health Services at 768-4613. Let the Employee Health Services staff let you be your best at work, at home, and at play.